Hi friends, let me ask you something. Are your periods irregular? And have you gained weight suddenly, especially around the tummy? Are you struggling with acne in your late 20s or 30s? Or are you trying to conceive but nothing seems to be working? And someone told you it's just stress. No, it might be PCOS. And today, in the next few minutes, I'm going to simplify PCOS for you. No medical jargon, just clarity. So, what exactly is PCOS? PCOS stands for Polycystic Ovary Syndrome. It is not just an ovary problem, it is a metabolic and a hormonal condition. The three main things which happen in PCOS are irregular ovulation, higher male hormones, that those are androgens, and third is insulin resistance. So because ovulation is irregular, the periods become irregular. And when male hormones increase, you have acne, facial hair, hair fall, and because insulin increases, there is weight gain, especially around the abdominal fat. And no, those cysts are not dangerous tumors. They are small, immature follicles due to missed ovulation. So, why is PCOS so common today? In the last 10 to 15 years, PCOS cases have exploded, especially in urban working women. And the main reason being sedentary jobs, high stress levels, skipped meals or processed food, and poor sleep, late nights, no strength training. But remember, there is also a genetic component. That means if your mother or sisters had irregular periods, you may be predisposed. But PCOS is not your fault, but ignoring it can definitely cost you. So, what are the symptoms you should not ignore? The common ones being irregular or delayed periods, weight gain, acne, excessive facial hair, hair thinning, dark pigmentation around the neck or the underarms, mood swings, and difficulty conceiving. So, what's important is that you don't need all symptoms to have PCOS. Sometimes the only symptom is irregular periods. And there is a definite insulin connection to PCOS. So, because insulin is the root cause of most PCOS issues. Insulin is a hormone that controls blood sugar, and in many PCOS women, the body becomes resistant to insulin. So, the body produces more insulin. Higher the insulin, stimulation of the ovaries, increase of the male hormones, and this totally disturbs ovulation. And that is why lifestyle correction is the primary treatment of PCOS. PCOS is a lifestyle sensitive condition. And are there any long term risks of ignoring PCOS? Yes, very much. If PCOS is unmanaged, over time it increases the risk of type 2 diabetes, high blood pressure, high cholesterol, infertility, endometrial hyperplasia, and anxiety and depression. And that is why I say that PCOS is not cosmetic, it is metabolic. So, can PCOS be cured? A most common question asked in OPD. And here's the truth: PCOS cannot be permanently cured, but it can be beautifully controlled. And many women reverse their symptoms completely with a structured lifestyle changes. So, the 5 pillars of PCOS control: first, strength training. Minimum 3 to 4 times per week is required because muscle improves insulin sensitivity. Second, protein focused balanced diet. No crash dieting, no extreme keto, balanced meals with protein, fiber, and healthy fats. The third, weight loss in case you are overweight. Even 5 to 7% weight loss can definitely restore ovulation. Fourth, sleep. A good 7 to 8 hours sleep is a must. Late nights worsen insulin resistance. And fifth, stress management. Yoga, breathing exercises, therapy, definitely if needed. Medicines like hormonal pills or insulin sensitizers may help, but they support lifestyle, they don't replace it. And many women are definitely worried whether I will ever get pregnant. The answer is yes. Most women with PCOS conceive naturally or with minimal support once the cycles are regulated. So, early diagnosis makes the journey smoother. Do not wait until 35 to address irregular periods. And if you have PCOS, you are not damaged, you are not lazy, and you are not indisciplined. Your hormones are asking for structured care. So, if you are an urban working woman struggling silently, get evaluated early. Save this video, share it with your sister or a friend, and remember, prevention is powerful.